Hi everyone, my name's Laura Hughes, and today we're going to be diving into our our hypoallergenic diet, which is a hydrolyzed diet. We will explore what allergies are, how they work, and why hydrolyzation diets can be a game changer for pets with sensitivities. So, we've got options for both dogs and cats. Everything we talk about today applies across species, but I'll point out any differences as we go. So what is an allergy? An allergy is basically the immune system overreacting to something harmless, usually a protein. Think pollen, flea saliva, or food ingredients. The key thing to remember is the problem is with the animal's immune system, not the allergen itself. There are a few types of allergy. So you've got a flea bite allergy, environmental allergies like pollen, that's atopic dermatitis, and food allergies. And yep, it's common for pets to have more than one type. So when we think about what are the causes of allergic skin conditions, we think about a flea bite allergy. So this is when the animal is reacting to the saliva from the flea when they bite them. Atopic dermatitis is inflammation to the skin due to the environmental allergens, for example, pollen or grass. And you could have a food allergy, which is a reaction to food. 30% of dogs with food allergies also have flea bite or environmental allergies as well. Food allergies are actually pretty rare. Only about 10 to 15% of dogs with allergic skin disease have them. That's less than 1% of all dogs, and it's even lower in cats. But when it does happen, it can cause severe skin or gastrointestinal troubles. So food allergies can look just like the environmental ones. So you may see signs such as itchy skin, vomiting, diarrhea, scooting. Sometimes it's hard to tell them apart just by the symptoms. So when we look at those dermatological signs, you may see things like non-seasonal pruritus. Clinical appearance is indistinguishable from atopic dermatitis, which is the allergy to environmental factors such as pollen or house dust mites. Atopic dermatitis typically starts at the age of 6 months to 3 years, whereas food allergies may start younger or older than this. Gastrointestinal signs are incredibly vague and can include chronic or intermittent vomiting and or diarrhea. They may also include increased defecation and perineal pruritus, so scooting their bottoms. Gastrointestinal signs may also accompany those that are showing the dermatological signs. So when we look at the immune system, there are built-in protections. Digestion breaks proteins down and the gut lining blocks those big molecules and immune cells help to suppress the reactions. But if these fail, allergies can develop. The body has several protective mechanisms against the development of food allergies. Digestion. Stomach acid and digestive enzymes in the small intestine break large protein molecules down into polypeptides or individual amino acids that are non-antigenic or only weakly antigenic. Mucosal barrier in the small intestine, the enterocytes, the lining cells of the small bowel are very close together, which act as a physical barrier to prevent large protein molecules from being absorbed. There is also a mucosal layer on top of the villi that act as a barrier. And then you have the gut-associated lymphoid tissue, otherwise known as GULT. Despite these protective mechanisms, there are times when the immune system is exposed to larger proteins. Immune cells, T suppressor cells, help to suppress the local and systemic immune response upon subsequent exposure to the antigen, which allows the dog to have an oral tolerance. A breakdown in any of these protective mechanisms can lead to a food hypersensitivity or allergy. So how does an animal develop a food allergy? Stage 1 is sensitization. So this is how a food allergy starts. The pet eats the protein, the immune system processes it and makes IgE antibodies that stick to mast cells, ready to react next time. Stage 2. So this is the response. So for a reaction to happen, the protein has to be big enough to bridge to IgE antibodies. So yes, size really does matter. So when we think about does size matter, we need to think about that in order for the animal's body to react to the protein, it must be large enough to bridge the two IgE antibodies, which then stimulates the release of histamine and the allergic response. So what is a hydrolyzed protein? So hydrolyzation is the process of changing the molecular weight of the protein so that the body cannot recognize it. So I'm going to be a little bit crude with my example. If you had a soya protein and that soya protein was a star shape, the process of hydrolyzation chops it up into smaller pieces or triangles so the body will not recognize it and therefore will not have the reaction. So protein is typically the cause of a food allergy. All dietary protein is potentially allergenic. Allergenicity depends on several factors, for example, exposure, size, and structure of the protein. Food allergens are mostly large molecules with a molecular weight between 18 and 36,000 daltons. A dalton is a unit of measure for molecular weight. If we look for a protein that is truly hypoallergenic, it should have a molecular weight of less than 18,000 daltons. But size isn't everything. Hydrolysis also changes the protein shape, making it harder for antibodies to bind. So it's about the protein type and structure as well. So why do we use hydrolyzed soya? Well, hydrolyzed soya is great. It's got a good amino acid profile, it isn't a common allergen, and it doesn't need heavy hydrolysis. We know that proteins that need heavy hydrolysis can result in a taste of bitterness. So, how do we diagnose a food allergy? So, we need to be aware that many labs do offer blood tests for food allergies, and many vets will still carry out those tests. But those tests have been shown to be unreliable and are not recommended by specialists. There was a recent study that took blood samples from healthy dogs that had no allergies and dogs that were diagnosed with food allergies and dogs that were diagnosed with non-food allergy skin disease. They split the samples and sent to two different labs for allergy testing. The dogs with no allergy had positive results. Two labs showed different positive results for the same dogs, i.e., one said the dog was allergic to the ingredient A and B, and the other said it was allergic to X and Y. So doing these tests can be a bit of a waste of time and money, as neither of them tell you whether the dog does or does not have a food allergy, nor what ingredients the dog is allergic to. There is no quick test. Blood and skin tests aren't reliable, and actually the gold standard is an elimination diet trial. Feeding a special hydrolyzed diets for 6 to 12 weeks and then either reintroducing the old food to see if the food returns or reintroducing an alternative appropriate diet. So we've got two options. We've got hydrolyzed diets like HA and novel protein diets like DRM. Today we're focusing on HA, but DRM is a great product too. So let's look at some of the differences between our cat and our dog diets. Our cat diet is complete and suitable for all ages, and it uses hydrolyzed proteins and selected carbs to reduce the potential reactions, and it's super tasty. It can be used in cats of all ages, and it also has a hydrolyzed digest, as cats must have a meat or fish-based protein within their diet. But the larger portion of the diet comes from soya, so there's less impact on the potential bitterness related to hydrolyzation of meat-based proteins. Now, it's always worth making owners aware that visually this product is quite different. I explained the cat product, it looks a bit like a cross between a Rice Krispie and a Golden Nugget. It's a very light colour. And it's very different to that traditional brown kibble that we're all used to for a dry food now. It also has a very high digestibility of over 90%. I think it's actually coming in at around 95%. And that means of what you put in, only a very small portion is going to come back out. So actually the amount and consistency of the feces that you're going to receive is a lot smaller. We do recommend you use this for the 12-week elimination period and then challenge after that stage. So from an additional benefits point of view, we've also got our omega-3 and 6 fatty acids to support the skin. We've got our STOX claim, which is to minimise the development of struvite or oxalate. And we've got our antioxidants, specifically vitamin E, to mop up free radicals that would otherwise be causing damage to the cells. So as I've already mentioned, we talk about HA being very highly digestible. It's got a digestibility of over 90%, which is really high in comparison to normal diets. And actually that helps to reduce the workload on an already compromised gut. So we have our composition and nutrient list there, and that's also on the packs and within our veterinary product guide for your information. So within this, we can click on each of the icons and explore a little bit around how this product is supporting and reducing the triggers and supporting this cat's body. So to just reinforce, we've got our hydrolyzed proteins that are much smaller than your typical allergens, making them safer for those more sensitive pets. We've got our purified carbohydrate sources, so this is reducing the antigenicity of the product, so they're less likely to cause a reaction. We've got our great taste, so they can taste a little bit different, but it's formulated to be palatable, leading, as I've already mentioned, with the hydrolyzed soy and having enough of the hydrolyzed meat protein to cover off the amino acids and fatty acids that are needed from meat-based sources. So to now go into the canine range. So it's the same idea as the feline range with hydrolyzed proteins, selected carbohydrates and your omega-3s, and it's suitable for puppies and adults as well. So again, the hydrolyzation process is about chopping up those proteins. So that's my cutting up your stars to your triangles analogy so that the body cannot recognize it. Both the wet and the dry formats can be used in dogs of all ages from puppy through to senior years. And we use the hydrolyzed soya so that it is a more easy diet to hydrolyze, and so that has less impact on the palatability of it. Again, just like the cat product, this is visually quite different. I always say it looks a bit like a it looks a bit like a Malteser that's had the chocolate sucked off, and it's a very pale beige colour. It's also got a very high digestibility, which means you're going to get very little out in return. So again, just like our feline patients, we would look at a 12-week elimination period and then challenging either with the original diet or another appropriate diet at that stage. So the additional benefits that we've got within our HA are we have the medium chain fatty acids. They are really easy to digest source of fat. They have a 2-stage process to break them down versus an 8-stage process. It's highly digestible and it contains those omega-3 and 6 fatty acids to support the skin. So let's talk a little bit about those medium chain fatty acids. So most fats in diets are long chain triglycerides, which are the most difficult fats to digest. But medium chain fatty acids are easier to digest and absorb by an impaired gut. In dogs, but not cats, fat digestion is impaired in GI disease. For example, if you look at dogs with EPI. So long chain triglyceride digestion is reduced by 95% versus medium chain fatty acid digestion is only reduced by 25%. About 20% of the fat in HA is medium chain fatty acids, and it's important to note that we do have to have some long chain fatty acids in the diet, as there are essential fats such as omega-3 and 6 fatty acids that are only found in long chain triglycerides. Medium chain fatty acids take only 2 steps to digest compared to the 8 steps for a long chain triglyceride. Medium chain fatty acids do not require lipase from the pancreas or bile acids from the liver. They are absorbed directly into the bloodstream, not via the lymphatics. They can be digested and absorbed even when hepatic, pancreatic, and intestinal functions are compromised. So high digestibility, just like we talked about with our cats, this product has an over 90% digestibility rate to reduce the workload on that compromised guts, which is particularly helpful if you're seeing GI conditions and clinical signs. So this is our nutrient values and our composition list for the product, so that you can see all of the information you would need to know about these products. So if we click on each of the icons here, we will be able to look at how we're managing allergies and intolerances as a recap across this range. So we have our single source hydrolyzed protein, which is our soya, and that's making it much smaller than your typical allergen, so therefore making it safer for those sensitive dogs. We've got our purified carbohydrates to reduce the angenicity of the product, and that's really why it's helping to reduce the impact on the compromised system. And then we've got those omega-3 fatty acids. So this is to help reduce the inflammation by replacing arachidonic acid in cell membranes. We use fish, soy, and rapeseed oils within this product. Now, to look at one of the studies that we completed around dogs controlling their food allergic response, the result of this study of 24 dogs that were switched onto the HA to manage pruritus as a result of allergies, 92% of these dogs remained free of clinical signs with the use of the HA diet. Now, looking at another study that we did with inflammatory bowel disease in dogs, and this is so looking at kind of the impact of our hypoallergenic diet outside of food allergies. The role of HA in irritable bowel disease management is thought to at least in part be due to the reduced antigenicity of the contents of the gut. So it's likely at least in part due to the hydrolyzed protein and also the high digestibility. Using cornstarch rather than intact grains, the source of medium chain triglyceride, and altered omega-3 and 6 fatty acid ratio. It's important to note that the dogs that were in this study were severely affected and had not responded to previous treatments, which included dietary change. So now what I would like to do is just take you through some of the results that we saw for the study with dogs with irritable bowel disease. So what you can see here is that 2 of the dogs within the study gained weight during the course of the study. 3 of the dogs maintained their weight, and only 1 dog lost weight throughout the duration of the study. And the dog that lost weight was newly diagnosed with EPI, exocrine pancreatic insufficiency, as well as having chronic IBD. So this is the likely cause of this dog's weight loss. Thank you so much for your time and attention. If you have any questions, please reach out to us on vettechline@purina.nestle.com. Have a great day.